Hi everybody, my name's Kevin Rogols. I'm the administrator at KMHC. I've been here for 7 years now, and the last year has been obviously very challenging for healthcare in general, and very challenging for all of our staff and all of the communities that we serve. Many of you have met me during orientation. Unfortunately, this past year we've not had the opportunity to have in-person orientation, and we have a lot of new staff. The first thing I want to do is thank all of you. Thank all of you for choosing to be a part of the healthcare world. You know, there are a lot of things that you could be doing with your time. There are a lot of industries that are in need of staff. And obviously, you know, a lot of people right now are even working from home, right? What we do every day, though, we can't necessarily do from home. What we do every day is to actually take care of people who are in need. And that makes all of you very special to us, because you've actually made a conscious decision that you want to be where you can actually, where you can actually help people. And obviously KMHC is a place where you can do that. And we thank you for doing that. We thank you for taking time out of all of your days, and in fact probably spend the majority of your waking hours taking care of people. That makes you all very, very special to us. The second thing that makes you special to us is the fact that you have chosen KMHC as your team. You've chosen to be a part of our staff. You've chosen to be a part of all of our initiatives, everything that we can do to actually improve the health and the quality of life of people that we serve, and we thank you for that. So first of all, thanks for being a part of our team. I mean, we all want to get back to normal, but we're not there yet. We're not ready for that. Now, what's different right now, though, is we have vaccines, right? And we have vaccines that are very, very effective. And I think to demonstrate that, we can turn to, I think, some pretty important data. This data is from last week, so it's probably aged by now. But the rate of infection, the rate of COVID infection per 100,000 population for vaccinated individuals last week was like 4.6. So if you think about that, 4.6 people out of 100,000 vaccinated individuals got COVID. Now, you might think that, wow, you know, I got a vaccine, but I got COVID. It's called a breakthrough case. But if you actually look at the math, you know, the Pfizer, for example, the Pfizer vaccine identified a 95% efficacy, you know, right out of clinical trials. Well, that means 5% of the people who got the Pfizer vaccine are still going to get COVID, right? So if you 4.6 out of 100,000. Was the data point last week. Now compare that with the data point of how many cases per 100,000 of unvaccinated individuals. Last week it's 350. So if you compare 4.6 case rate for vaccinated individuals versus 350 for unvaccinated individuals, the vaccine works. And we are absolute proponents of people getting vaccinated. And we appreciate and we very much respect that. Everybody makes their own choice, and we respect that. We abide by that. But we believe in the science. We believe that the numbers actually, they speak for themselves. I'll give you another data point. So late last week at KMHC, we had 11 staff that were off with COVID, and we don't want anybody off with COVID. All 11 staff were unvaccinated, right? So the choice is our staff. The choice is it's yours, and we respect that, but we are absolute proponents of vaccine. And I know, you know, people are going to be watching this thinking, oh, there he goes again. Well, here I go again. The data speaks for itself. 4.6 COVID cases per 100,000 vaccinated individuals versus 350 COVID cases, right, for 100,000 unvaccinated individuals. And the proportion of staff who are off with, unfortunately, COVID, who have not been vaccinated. So we would like everybody to get vaccinated, and we have ample opportunity for our staff to get vaccinated. Well, I did get the Pfizer vaccine, and I got the vaccine in January. And first of all, our clinic did an absolutely wonderful job. They provided education on what to expect with the vaccine, all of the how it was going to be administered, and the two-dose system, and really what to expect with regards to, what could the side effects be. And they did a great job. My first vaccine, tell you the truth, other than a little bit of a sore arm, I got the vaccine and I went down to the gym and, worked out for 40 minutes and finished my day, and, it was really kind of a non-event. My second vaccine, my arm was a little bit more sore, and I must say that night I went to bed early and I slept like a baby. I was tired. But within 24 hours I was back to normal and had no other side effects other than a little bit of tiredness for that 24 hours.